Hello, welcome to Mirror Clinic. My name's Dr. Andrew Clark. Today I've got Sandra coming in, and Sandra's kindly agreed to let us film her treatment, and during the treatment I'll be able to explain to you what we're doing and why. She's had some concerns with the skin, with oiliness, breakouts, and some textural issues and early lines, and so we've decided that we're going to get her on some good quality skincare. We're going to do a Hydra Facial today and get her on a course of regular Hydra Facials, and today we're going to do some wrinkle relaxer. Sandra's had wrinkle relaxer before, but it's worn off, and so we'll have a little bit of a look at the movement that she's got going on at the moment, and I'll explain to you what the objectives of the wrinkle relaxing treatment are, and then hopefully we'll get to watch some treatment and learn a bit more about why we choose the doses and the injection points that we do to get the best results. So I've just had a chat with Sandra, and she's currently getting a Hydra Facial with Sarah, our dermal therapist, and you guys will have seen some footage of that, and in a minute she'll be coming in here for the wrinkle relaxing treatment. Sandra's finished her Hydra Facial, and I'm just going to go and see how it went, and then we're going to go and do some wrinkle relaxer, and I'll talk to you about that. Guys, so after you've had a Hydra Facial, it's the perfect time to get some treatments done, and this is what we commonly do, is that we book in a wrinkle relaxing treatment or a laser treatment after our Hydra Facial. Ready to get the treatment underway? I'll get you to rest your head back, and then we'll do a little bit of a clean, and there's some alcohol vapor in the cleanser, so just keep your eyes closed while that's going. Okay, so even though we've done the Hydra Facial, we still want to make sure the skin is really nice and clean for any of the needles, and so it's my habit to always do a gentle wipe with that alcohol wipe, which just gets rid of any bacteria that might still be on the skin, so that it's safe to do the injections. There's some debate about whether or not it's even necessary. Some people will inject Botox without doing the alcohol wipe, but I think it's cleaner, I think it's nicer. And if someone comes in here and they haven't had a Hydra Facial and they've got their makeup on, the makeup might be hiding their veins, and if I don't remove a little bit of the makeup to see the veins, then it's a bigger risk of getting a bruise. When there's no makeup on, I can see the veins, and your risk of a bruise is much, much less. So the first thing we do after the clean is to actually look at the motion and watch where the muscle is and work out the best spot for the injection points. And we want to look natural. We want a little bit of a lift, but we don't want anything too strong. We don't want the middle to go down, and so we need to sort of get a nice even dose across here. Alright, so lift your eyebrows up for me and relax. And lift up again, and relax, and lift up again, and relax, and lift up again, and relax, and do a frown, look cross. And there, I'm not going to mark all of the spots for the glabella area, but instead we're going to mark the furthest out spot that we're going to do, and then do a big sort of squinty winky smile, see if we can see some of these lines. Give us a cheesy smile. Ready? Show us all your teeth, big smile. That's it. And relax. And do that again, and relax. And these ones, even though the lines here are not too noticeable, when this kicks in, it's going to actually open this area up, and so we're going to look a little more alert with that crow's feet result.
You wait till you see this one's off as a cracker. It's the coolest thing. You're alright.
I might change my hands. Maybe.
Cool. All right. So Sandra, are you ready?
Yes, I am.
So we're going to do the injecting now. We're going to blur out the needle so you don't have to watch the needle if you're watching along and you're scared of needles.
Mm-hmm.
And I'm also going to, what was I going to say? Blurring the needle. Oh yes, that's what I was going to do. And that, I'm talking to the camera now. So a lot of people might be wondering what it is that I'm about to inject, because this is kind of really advertising, or at least the medical board thinks anything that I publish is advertising. Then I can't say the name of the medicine that I'm injecting. So it's pretty well known. I'm sure everyone's heard of it. I can't say it. There are 3 brands available in Australia. I can't say any of the 3 brands in this video. But when you come in for your consultation, we can have a chat about the different brands. I don't think there's really any difference between them, as long as the dose and the injection points are correct. You're not really going to notice any difference in terms of how well it works or how long it lasts. And so it's not the right question to ask, which brand are you using or which brand should I use. The right question is, what dose am I going to get? Where's the injection points? And of course that's something that the injector needs to be able to do for you. It's not something that you can tell the injector what to do. And so that's the best way to pick what product you're going to use.
Hey guys, so I'm just gonna get my wrinkle relaxers done. So the Dr. Andrew just put all those marks. This is when the injections will be going to. And Dr. Andrew, would you like to say what these points are and what they will do?
Okay, so we've got these pencil dots on Sandra's face just because it's really important where the dose goes. It's not important which brand you use. It's important that you get the right dose in the right place. And by marking them out and watching Sandra's movement, I can much better predict exactly what she needs and where, and we get much better results. The key is that you don't want to do too much wrinkle relaxer. If you do too much, it'll look really frozen and fake, and it can actually drop the eyebrows, and you can end up looking kind of like that. And we want the eyebrows to stay in the same position or move slightly up, and it's about getting the balance right between the dose through the brow and the dose through the forehead. And also by doing the dose on the crow's feet, we're going to open up the outside of the eye, and we're going to look less sort of closed up and more open and fresh on that spot. All right, we ready?
Yes.
Let's get started. So there's going to be a little needle now. Perfect. Okie dokie. And now we'll do the other side. If you have a little bit of bleeding after your injections and the injector just like walks away or does something else or keeps going, then there's a chance that some of the little bits of bleeding can accumulate between the blood vessel and the skin, and that's what gives you a bruise. So if after each set of injections we have some gentle pressure, it stops the bleeding and it stops the blood from accumulating under the skin, and it reduces the bruising or eliminates the bruising. So next up is we're going to do the forehead, and so we're going to do these injections over here, and little needles now. The other reason that I like to mark things out is that unless you stand over the top and have a look, so when I was marking it out, I'm like making sure it's perfectly even on both sides. And people that do all their injections from one side, if you watch, they tend to do more injections towards them on the near side and more injections towards them on the far side, and then they end up not injecting far enough around there. And if you've got a different dose on the two sides, it's going to give you a different position for your eyebrows. Alright, so we'll keep going with this. So now we've done 2 out of 3 areas, crow's feet and the horizontal forehead lines. And then last up we'll do this area, which sometimes we call it the frown, because it's that frowning cross look. But the medical name or the technical name is glabella, because it's very specifically refers to this area, whereas sometimes when you say frown, people think that that's frowning, lifting your eyebrows. Alright, so now we're going to do this bit. Injection in the middle. And then we go along one eyebrow. And the last spot is very close to that last pencil dot you saw me make. And then I do the other side. And you'll notice the way I kind of lean around, and that's so that I can get the needle moving in the direction of the muscle fibres, which I feel helps you get a nicer distribution of the product and therefore a nicer result. And same as before, we're going to do just a little bit of light gentle pressure on the injection points till those little pinpricks stop. And once those pinpricks are stopped, we do another clean. That's just to make sure the injection points are nice and clean. It's also to get rid of the pencil dots, and it's also to get rid of any little pinpricks. And the other really good thing about coming in for a Hydra Facial before your wrinkle relaxing injections is Sandra's now got all her makeup off, and so I can give much better advice on how to look after the skin, what skincare products to use, and what our sort of treatment goals are going to be. Down the track, when we've got Sandra's skin looking really nice and healthy from the skincare and a couple of Hydra Facials, we're going to have a chat about the way that we can reduce some of the little sort of unevenness in the pigmentation, and also a little bit of unevenness in the redness, and there's a few little broken capillaries visible as well. And so I'm hoping we can do some laser treatments and then even out the skin, so your skin's going to look so much better without makeup. So we're going to swap over to the other view and have a look close up, and I want you to see if we can see the needle holes, because people are really worried that they'll get their wrinkle relaxers and then they have to stay at home for a week or whatever. And it's just not like that. Look, sure, sometimes some people bruise, but if the injector's experienced, if the injector has a few little tricks in terms of knowing where the veins are or seeing where the veins are to avoid them, and even if they do cause a little bit of bleeding, if they get the pressure on, the right amount of pressure straight away for the right amount of time, it's very unusual to get bruising. So let's have a bit of a look and see if you can actually see the needle spots. And maybe in the middle there's a little one, maybe there's a little one. It's pretty hard to see any there. It's pretty hard to see any on the crow's feet area, and just the rest of the forehead. There's a little spot there where I didn't clean it very well. But it's actually looking fantastic. It'd be very hard for anyone to notice that Sandra's just had a treatment. Now the thing is, in about 10 minutes time, all those little pinpricks will have sealed over, and so it's quite safe and quite common, and I'm very happy for my clients to put makeup on. So tinted moisturiser, SPF with tint, foundation, all of these things are fine. It's just that on the day of the injection we want to be gentle. We don't want to be rubbing the injection points. We don't want the wrinkle relaxer to get pushed into different spots. And so if you are putting any products on afterwards, just keep the contact quite gentle like I'm doing now, and don't sort of do a deep rub or massage to get those products on. Same thing later on tonight, we want to remove any makeup if you do put some on later. And when you're removing makeup later tonight, or if you're just doing your normal cleansing later tonight, my advice is that where we've done the injections, we want to be wiping away from the eyes, so backwards from the eyes and the crow's feet area, upward from the eyes along the eyebrow and on the forehead. Now, under the eyebrows we haven't injected anything, so it's fine for you to do a normal cleanse of the eyelid makeup and the eyelash makeup, and you can do normal cleansing of the face below the eyes. As long as you wait 4 hours after the treatment, I'm happy for my clients to go to sleep and not worry about how they sleep. If you roll over on your side or on your front, it doesn't really matter as long as you've waited that 4 hours before there's that pressure from sleeping on it. I don't think it's a good idea to fall asleep or have strong pressure on your injection points within 4 hours. So sometimes when we're open late and we're injecting till 7 o'clock, just keep that in mind, because I want you to stay up until 11 p.m. before you go to sleep, if you have an injection at 7 p.m. Now, with exercise, there's not a lot of good studies telling us exactly what the rules should be, but for a long time we've told many thousands of patients that it's best to wait just 24 hours, and people they have active lifestyles, they go to the gym professionally, they're training for particular events, so you can actually do a treatment in the morning, come and get a treatment, and then 24 hours later you can train really as hard as you like without any limitation. But I prefer people not to do very strenuous, very vigorous training before the 24 hours, because I just don't know if the wrinkle relaxing medications had a chance to bind to the receptor, do its job before all that extra blood flow might wash it away. And if you wash away your wrinkle relaxer before it works, it does two things. First is that it can decrease the result, because we've injected the right amount today, and if we wash some of that away with vigorous exercise too soon, it's only a percentage of that that's going to work, and so the result may not relax your muscles enough, and it may not last long enough. So that's the first thing. The second thing, and there's no evidence that we know this for sure, but we suspect, or we worry from certain stories, anecdotes that we've had where clients have had issues, where people talk about getting the side effects of wrinkle relaxers like the droops or the heaviness. It might be because exercise too soon has actually caused the extra blood flow, which has caused the wrinkle relaxing medication to spread away from where it's supposed to be and relax things it's not supposed to relax, and therefore increase your risk of a side effect. So they're the two reasons we have those rules. All right. So next thing is, it's really important to feel as though you can communicate with your clinic, with your injector. And the first time someone gets any wrinkle relaxer, I really want them to come back and see me 10 to 21 days afterwards, so I can look at the result. And if you're getting it for the first time, you don't know what a good result is, and I can have a look, and if you need a little bit extra here or need a little bit extra there, we can do it for you. And in our clinic, we don't charge extra for that. You've had it before, and so it's really up to you with whether or not it's convenient to come out here and see me, whether or not we do the review. So if you can't come in, or it's a bit hard to come in, we can give you a call or send you an email around 10 days and make sure everything's okay. But I think we're going to see you anyway, because we want to take some pictures of the result. So let's do that.
Yeah, definitely.
Any questions?
No, pretty self-explanatory.
Cool.
Covered everything.
All right, perfect. Thank you.
Thank you.
Any particular time, like I think you told me before that you saw the little frown lines when you're working out?
Yes, so definitely it's the frown line here in the center. Yeah.
Yep. So I'll ask you to do the movements, and then I'll say, so is there anything that you've noticed, and then you can talk about that. Okay, cool. All right, so let's do some movement because I want to see, you know, what the situation is like at the moment. So lift up your eyebrows as strong as you can, and then relax, and then turn into a strong frown. That's good. All right, so there's a fair bit of movement there. And is it sort of, you know, has it been bugging you? What's the reason that you've come in to get it done now?
Yeah, I just want more natural look, definitely, and because I'm training so hard, and obviously my face expression is